Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
This week on Health Today, Pediatrician Dr Ranita Jhagroo explains the importance of an annual checkup for students.
Well, one of the things that we often recommend when children are going back to school is an annual checkup, often with a pediatrician, because they are more directed towards the health of kids. And during that visit, one of the things that they will often do is review the year that has just passed in terms of health issues. If a child, for example, has had any sort of chronic health conditions such as asthma, allergies, eczema, things like that, then the pediatrician will sort of go over what has happened over the year and ensure that you as a parent are comfortable in terms of the frequency, duration, and dosage of any medication that they may be on, as well as any avoidance of any of the triggers that may be needed. Okay. The other thing that they would often do is assess the growth of your child over the last year, because remember, this is usually an annual thing, so when this assessment is done, it's a comparative one from the year before. So they'll be checking their weight and their height, and for older children, their what is known as the body mass index. And of course, fluctuations in weight gain or falling off in weight gain or the body mass index in terms of the growth percentiles would be discussed, and how as a parent this can be addressed. The other thing that is often done at this visit is a sort of overview of the overall school performance in the last year. And so I would often advise parents to walk with their child's last school report, which they would have just had from before summer vacation began. Some parents actually bring their test results. And if there are any concerns that have been voiced by the school or by their teachers, this is often discussed with your pediatrician. And the rationale behind that is sometimes allied health professionals such as speech therapists, child psychologists, occupational therapists can often be recommended by your pediatrician. The big area, of course, is immunizations. So walking with your green book so that you can just make sure that they're all up to date in terms of their vaccines, and if there's anything that's missing, it can be given before September starts. There are a few screens that we often recommend when it comes to kids. There's something known as the vision screen. This is usually done most accurately from the age of 4.5 years and onwards. Now, some of the schools, in particular the private schools, will actually offer this at that age, but otherwise I usually recommend that parents organize it themselves. It could be done by any optician, and ideally this is done annually, especially if there's a family history of any visual problems such as short-sightedness, long-sightedness, or anything like that. The hearing screen is also important. That's usually done in preschools in the private sector. But if it hasn't been done, then again, that's something that should be done by the time a child is 3 years of age. And the reason behind that is then if there is a problem, it can be picked up early. And if there's a problem with speech, that is often picked up at that assessment, so that again, intervention can be done early. And of course, the dentist. As adults, we see at the dentist every 6 months, and children are renowned for not brushing their teeth properly. And so going to the dentist every year, if not every 6 months, is important. And older children should definitely be seen by the hygienist in the dentist's office and be given a clean at least annually as well. The reality is once school starts and you get into the swing of things, that these things are going to be put on the back burner. So just like every adult will have an annual checkup and they'll be told, okay, for example, women, that you should have this done and that done. These are some of the little ticks that should be addressed ideally before the school's year starts. Now, things like vision in particular are very important, because children, unlike adults, will not appreciate that they're having difficulties in school in terms of vision. What often a child who's having difficulty sort of seeing the blackboard or the whiteboard in certain cases, or even in their work in front of them, will just become disinterested in their schoolwork. And the teachers would often say that here there's a child who was performing well and now they're not performing as well and they're distracted. And it could be something as simple as they're just not seeing as clearly and it's difficult to focus, and that's why they're not managing. The health check is very similar. Of course, you'll be talking to parents about, in particular, how they're going to manage in terms of foods, because remember, these are children that have been at home. Some of them have been at nursery, but the nursery has often been providing food for them. So I tend to go through a guideline of what they should be sort of packing for them in terms of their meals and the frequency of their meals as well. The difference as well in terms of the checkup is just the weight is important at 3, their speech is important at 3, and their development is important at 3. So those are some of the things that we would like to make sure that are acceptable or that they are developing appropriately, during that visit. One of the things in terms of medical care is prevention. And sometimes a lot of these illnesses that we see in kids can be prevented. And the only way that you can prevent that is to actually have a checkup and have these things checked before they become an issue. Immunizations is one way of dealing with that. Screening for visual problems is another way. Dental checkups, hearing screens, developmental checkups, all of those things are done with the idea that if you pick up on something early, you can do something about it early before it becomes a problem. And with kids, when it becomes a problem, it affects them overall, not just that area, but an overall